Thank you for joining us here on the NPTE Final Frontier podcast. My name is Dr. David Friedberg.
And my name is Dr. Emily Gerby. Today we're focusing on pulmonary auscultation breath sounds and what they mean.
So, what do they mean? Well, let's answer a question first. A physical therapist auscultates a patient's lungs and notes continuous, low-pitched, rattling sounds that resemble snoring, most prominent during expiration and heard diffusely over the lung fields. Which of the following best describes both the breath sound and its most likely underlying cause? Is it option A, wheezes due to airway narrowing from bronchospasm? Option B, crackles due to fluid in the alveoli? Option C, rhonchi due to mucus in the larger airways? Or is it option D, pleural friction rub due to pleural inflammation?
All right, so let's dive into each of those lengthy option choices to determine which would be the best option choice. Because remember, our patients has continuous, low-pitched rattling sounds that resemble snoring, and it's most prominently heard during expiration and diffusely over the lung fields. All right, so first up was option A, wheezes due to airway narrowing from bronchospasm. Now, wheezes are high pitched and musical in sound. They're caused by airway narrowing, usually from bronchospasms. Now, you'll most commonly hear wheezes with conditions like asthma, COPD, or even a foreign body aspiration. They are typically heard during expiration, although in severe cases, they can also be heard during inspiration. But here's the quick key. The question describes the sound as what? It was low pitched, rattling, and snoring like. So that rules out wheezes because that is not what we heard here. All right, next up is option B, crackles due to fluid in the alveoli. Now, crackles are discontinuous breath sounds. They sound more of like a popping, bubbling, or crackling, and they're most often heard during inspiration. Now, they're associated with fluid in the alveoli. So, with fluid, let's think of conditions like congestive heart failure, pulmonary edema, pneumonia, or even pulmonary fibrosis. This question specifically says that the sounds are what? It mentioned the sounds as being continuous and rattling, not discontinuous and not popping. So that gives this option out. We can cross off option B. Next up, we have option C, rhonchi due to mucus in the larger airways. Now, rhonchi are also continuous. They're low pitched and rattling breath sounds that often resemble snoring. They're caused by mucus or secretions in the larger airway, and they're most commonly heard during expiration. Conditions we'll see with rhonchi are COPD, chronic bronchitis, bronchiectasis, and pneumonia with secretions. Every single descriptor in this question lines up with rhonchi, meaning that option C is the correct option choice. But let's still look at option D, which was pleural friction rub due to pleural inflammation. Now, a pleural friction rub is a harsh, grating-like sound caused by inflamed pleural surfaces that are rubbing together. It's usually heard during inspiration as well as expiration, and it's normally more localized, not so diffuse. And this is associated with conditions like pleuritis or pleural inflammation. This doesn't sound rattly or snoring like, and it's not typically described as continuous airway noise. So this is why we can also cross off option D. So now that we have gone through every single option choice, this does in fact confirm that option C, rhonchi due to mucus in the large airways, is the best option choice because remember, our patient here had continuous, low pitched rattling sounds that resemble snoring, prominently heard during expiration, and heard diffusely over the lung fields. Great job, Warriors.
Talking about snoring, we have a few team members on Final Frontier that. Wait, this isn't the time and place for that. But. When you hear a breath sound question, always ask yourself two things. What does it sound like? And also, what's happening physiologically? The NPTE loves pairing sound quality with underlying pathology. So, Ronkai, you're going to have that low-pitched, continuous, rattling or snoring, mucus in the large airways. Wheezes, going to have high-pitched, musical, usually expiration, narrowed airways. Crackles, going to be discontinuous, popping or bubbling, often during inspiration, and also fluid in the alveoli. Pleural friction rub is going to be more harsh, grating, inspiration and expiration, localized pleural inflammation. So that's going to help you out a little bit.
And I love what David just did there because what did he do? He highlighted the key words. And when you're studying for your NPTE, what you want to do is look for those key words, underline, highlight those key words, and then when you review your option choices, it helps you get rid of a lot of the extra fluff surrounded by questions so you can just hone in on those keywords to make sure you succeed on that exam. Now, for us as physical therapists and physical therapy assistants, these breath sounds matter because they help guide treatment. And remember, that's always what is most important, how to best help our patients. So this helps with airway clearance decisions, proper positioning, breathing interventions, and when to escalate care. Never forget to remember when to refer out. So a last piece of advice, I want you to remember this. If you hear rhonchi, think about secretion management. If you hear wheezes, think airway narrowing and breathing control. And finally, if you hear crackles, think fluid and also check their cardiopulmonary status.
Now that you heard this episode of the podcast, here is a quote from Emily Dickinson. One step at a time is enough to get you there. So continue taking those steps. But the most important one is that first one. Go ahead, take it. It's going to be okay. You are powerful. You are strong. You are a Final Frontier warrior. You will pass.
Thank you very much for listening. For more information on the Final Frontier, please visit npteff.com. You can check out all of our social media platforms such as Facebook, Instagram, TikTok, and X.
Till next time, have a great day and a powerful tomorrow.